as a PCQI, you're going to need to start creating your microbiological criteria program at this stage, because you're going to take a look at that risk of that new ingredient. Here we go again. Hello again, PCQIs. In this video, our topic is going to be product formulation and realization program. So we are reviewing this particular program to update and add some newer methodology for our client's intended purpose. Okay. So the first part of it is this particular facility or process. Obviously, it's for food manufacturing. So we've embedded the 21 CFR 117.160 compliance requirement for validation verbiage. So you can look that up at 21 CFR 117.160. This particular program is also based on SQF requirements. So I'm going to go over those. I'm not going to read you all of those sections. Just going to go over of some of the things that we are adding or have added to this particular programs, policies, and procedures. So the scope of this program, it's going to be talking about formulation and bench and pilot scale, plant and or test kitchens, full-scale plant production, as well as the verification and validation of the food safety plan. Sorry guys, I'm looking at you. I'm looking at my notes here so I don't get lost. So part of this program, the policy that's been implemented, that is all new products or revision thereof, the existing product, are first developed in a pilot scale. The formulator or the developer, it could be somebody in-house, when they are putting all of these together, they are already planning on getting these pilot program to escalate to a bench/pilot scale production for full commercial production. Okay. One of the purposes includes the food safety plan to be updated for the revised product, to monitor shelf life trials and process capabilities, and obviously the validation, label declaration review, allergen cross-contact trials. This also applies to all of the new products and changes to existing products and the introduction of new raw materials or pack sizes. So that's kind of their overall policy. I just tried to summarize all of it so I don't bore you with all of the other verbiage on this program. Like I said, if you need help, let us know. info@consultainc.com. Okay. So we've added in this program the procedure part of it now that we've determined the policy of the company. Part of that is the formulation. So the formulation is determined by an authorized formulator via in-house or a third party. And because the client also entertains OEM, as well as white label, those are also, the formulations also under those customer requirements. Okay. So the section of the formulation is addressing procedures for bench/pilot scale. Okay. A process where the customer or sales requests a new product or revises an existing product to be created for evaluation for commercialization scalability. So this is where we discuss how to take the prototype, take it to the next level of commercialization. It addresses also sampling part of that, and based on organoleptic requirements, nutrition profile, product desired claims of the company or the customer or the formulators that they wanted to introduce into the market. Okay. So the bench trials on this one, the production team are the ones that are designated. It is not outsourced. It is designated to the production team members, and all formulation changes created or approvals are tracked. Okay, so make sure those are documented. And now some part of this process, they also use a third-party formulation module or recipe management. If you need help on that, let us know. You can go to itblaster.net and see some of our current projects. If not, kindly just contact us, and we will be able to demo what that looks like for you. Part of this is a section on the new ingredients and allergens introduced and are identified during this process. So those are also have their own procedures for the food safety plan. Okay. Now the allergens are assessed by the quality department, and also the quality department will then take a look at the sanitation processes and the process flow of manufacturing on the line. So typically, as a PCQI, you want to take a look at that and basically look at or observe which allergens are being introduced on your line. Best practices is production with no allergen goes first, and then with allergen next. Now, if you are working with multiple allergens in your facility, for example, let's say you have sesame as well as dairy in your line, and dairy is being used by another process, but sesame allergen is not. So you might want to run that first, and then when you run the second line that has dairy allergen and sesame, then that would be perfect. But if you ran it the other way, now you have a higher risk of cross-contamination of the sesame on the next run. Okay, so I just wanted to give you that little bit of that tidbits of what we've observed and seen on best practices that actually conform to the allergen management or allergen control program. Okay, in this section, the quality department is also tasked to review the labels per 21 CFR Part 101 for our food labeling requirements. This will include claims, special claims, update on ingredient approval list, as well as corresponding supplier approvals, COA specification letter of guarantee, letter of conformance, and allergen declarations, and others. Okay, so the quality department is in charge of that. We've mentioned the quality department updates the food safety plan and any other changes. Food safety plan / HACCP because of the new risk that could be introduced or will be introduced with these new ingredients or new raw materials. Now, there's going to be some information we've added here for customer when they're aiding on the production in determining the production specification and quantification scaling. So we get the basic information for the companies to be added in this process, such as their contacts, delivery information, and their basic information, phone, fax, email, to be on record, because if we are formulating it and scaling it for them. Okay. Lead times at this stage are also collected and at first scheduled ship dates. The lead times are determined by your slowest process when ordering your raw materials. So for example, let's say you have 11 or 12 or 15 ingredients in this one particular finished product, and number 8 and number 11 ingredient, their lead time comes in, let's say in 2 months. Well, guess what? You can't manufacture without those 2 ingredients or with one missing. So your fastest process is determined by your slowest one. Okay, so that's why. So the lead times at this stage are then recorded, so then we can then take a look at, as well as the shelf life of the raw materials, expiration date monitoring, as well as once everything is mixed up, the shelf life determination. Okay, product description, product code, and as well as shelf life is collected at this stage. The desired shelf life or expiry date of the customer. That data will be then used when we're performing the shelf life protocols, for actual study as well as accelerated for shelf life. The formula, the quantitative formula, is also collected at this stage if there is one. If not, then we will then create that in-house. Packaging desired by the customer is also collected at this point. We're looking at sizes, the quality, the case, the weight, as well as your palletizing requirement. At this point, pallet information, height, cases, number of cases in a pallet, and pallet weight, etc., etc. Especially if the product is going overseas, there are different configuration on a 40-foot container compared to a regular one. So at this stage, these are very important. Product quantities per batch or per lot is desired. So at this part of the scaling up, we also look at the capability in-house for production, blender size, packaging, flow rate on conveying systems. So all of this will play a very, I'd say, dramatic role in this scaling up, because it's then also going to depend on your amount of people you're going to need, the process, the length of time of producing it, holding the product and quarantining it, which will affect your storage and warehousing capabilities. So at this stage of your formulation and scaling up process, you're going to want to consider those. Okay. Part of this program, we've added the plant and test kitchens. If you are using a test kitchen, we put some procedures here as well of how to manage those processes. At the plant and test kitchens, once you start running the pilot or the scale-up process at this stage as well, the food safety plan or HACCP, depending on the facility, needs to be monitored for changes. This is where you're going to then validate that after this exercise is completed, to make sure your food and safety plan works with your new process and everything's in line. Along with this section, the production team will assess the first production run to determine the product commercialization viability. Okay, so we're going to then take a look at this point the product performance, organoleptic characteristics, packaging integrity, and the shelf life determination. Now, the requirements that I'm going to be discussing next are process controls, where the process narrative needs to be updated on the food safety HACCP plan. Quantitative formulation will be finalized at this scale. Personnel training requirements, that's very important. Once you have all of these things put together, right? Don't forget the team, because they're the one that's going to be putting all of these things together. Sanitation and allergen controls are determined at this stage. Equipment and utensils qualification, obviously, are determined on this stage. Processing aid for this stage, if you're using water locally sourced, all of those testing parameters for that if it becomes part of the finished product, or any other processing aid, depending on your process, okay? Product storage and handling are determined at this stage. So your SHI, your shipping and handling instruction, are going to be monitored at this stage of the process. Packaging integrity, I get asked a lot on drop test. It could be a vacuum test, crush test. So there's a lot of things that conform to packaging. So just contact us to see what process you're doing, especially if you're exporting. We've ran some tests on boxes and cans or canned goods and composite cans or composite packaging that are going to export. So while I'm on that subject, if you're looking into that, please be mindful once you put the product on the container for export, account for the up and down vibration of that container being transported, not just on our local roads, which United States, we're fortunate enough to have good roads. I know you're going to be saying, Arnel, you don't live where I'm at, where we have potholes. Well, I've worked with international clients where our potholes here are still nice. so keep that in mind when you're working with a third-party company that are doing those type of validation or testing for you, so you'd have that data. I've had incident where I shipped overseas where I was losing between 2 to 8% of shipment because the last 2 or 3 cases under before the pallet there that are on the bottom, they just get damaged because of that up and down vibration as the truck goes rolling along. Okay, so I wanted to just share that with you for prevention. Product stability and shelf life study or trials. Now this is where the best use by date or best if used by date is determined. Now in this part, some of the things that we've observed, companies do actuals and also accelerated. So for those process, kindly contact us so we can give you more details on those protocols and actually give you the proper procedures and SOPs depending on your products and what you're claiming your shelf life is going to be, okay? And including testing parameters and all of those, all right? On this particular example, this particular stage, the client had put in their processes on here, their how they look at their organoleptic, their what do they test when they are sending it to the lab, and all of those things. Obviously, I can't share that with you, but this is the part where we enter those processes, okay? Now, you're gonna ask, or probably thinking right now, well, we don't do shelf life study because our product pretty much are just 2 weeks to 4 weeks or 6 weeks, and we're basically that's determined by either customer complaint or a visual inspection of the product molding or whatever that physical changes on the product up to a certain date. Now, if you're not doing shelf life and that's part of your justification, just document that so then you can show evidence of that if you are getting certified or being audited for that shelf life trial requirements, okay? So just put the documentation supporting your claim at that point, or that decisions, okay? After this plant and test kitchen, obviously you're gonna go to a full-scale plant production. When it comes to this stage, there's your departments, which is your production, maintenance, sanitation, quality, and the purchasing department. This is where all that traffic is gonna flow and everybody is gonna synergize. So I just want to point some things out when we're working on the product and realization program. So the final step of this product formulation for these finished products are developed for distribution and basically marketing. So production's role on this one is to put the process controls, okay, for the quantitative formulation and make sure it follows the specification if it's in-house or the customer requirements at this point. The batch sheet or whatever you're working with, if you're working with a dietary supplement, obviously you have your MMRs. Make sure you have all of your deviation documents ready. because once you're going to that full scale, there's going to be a lot of deviation that's happening. Pay close attention on your equipment performance at this point. So your DQ, IQ, OQ, PQ, right? So you got your design qualification, installation qualification, right? And operational qualification. Now on the PQ part, I put production qualification because that's where the production team really comes in and qualify the line with maintenance. So synergizing with maintenance, this is where things come together, where things needs to be moved, calibrated, and basically adjusted to fit you packaging products and observing the traffic from your team. So maintenance is going to be hand in hand with the production team at this stage. All right. So I mentioned calibration. So let's go back to maintenance. So calibration of the equipment that will conform to the customer requirement and also the product specification at this point. After maintenance have done these, obviously you're going to have your quality department there as well as your production team to make sure all of those processes are documented. As a PCQI, you want to pay close attention to that because later on when you're doing inspection or verification activities, once you start seeing tape, okay, or certain wedges or certain, who knows what it is, creative way to calibrate or adjust machine, you're going to see it. So during a certification audit or any audit, right, that is very frowned upon, right? I do not like it personally. I'm going to tell you, okay, because that just leaves other slew of any other cross contamination that could be part of that. So we can discuss all of these other things, but as a PCQI, take a look at that because at this stage, when things are not jiving well with the finished product and how maintenance did their job, once they leave, you're going to have your production folks, they're going to radio in and they're going to get frustrated. Next thing you know, they're going to take a piece of cardboard, they're going to slide it in to make things work just a little bit, and they're going to start taping it. You're going to see duct tape, clear tape, packaging tape, and it's just going to create more problems, down the line, especially when it comes to sanitation time. Everything is getting wet, right? Anyways, we can talk about those other stuff of craziness later on, but I just want to let you know that at this stage, pay close attention to those problematic areas when conveying the products, okay, or producing the products. Now, the sanitation, let's not forget, they are very, very vital on this new process because they're going to have to then take a look at allergen controls with you as a PCQI, and also adjusting SSOPs, going through QA validation with you. If you are validating cleaning through swabs via environmental, there's a new allergen that's been introduced, what those cross-contamination look like, and SSOPs to be adjusted, and also your allergen test kits that needs to be purchased and made available. So be aware of these certain changes and whatnot. Now, a lot of us folks, right, determine cleanliness as a verification using ATP, right? Adenosine triphosphate swabs, okay? So this do not swab pathogens. So just be careful how you use that, okay? Now, at this part of it on the sanitation, QA, based on the observation of QA, as well as the PCQI. As a PCQI, you're going to need to start creating your microbiological criteria program at this stage because you're going to take a look at that risk of that new ingredients and allergens and how people move around this new process from different zones. So you need to then take a look at those potential biological hazard, and when you start working on your HACCP/food safety plan, put those parameters together. What are you testing? When are you going to test it? And when it comes back from the lab, what are your parameters to give it a green light, an orange hold light, or a red light? However those analogy works out for you. Basically a pass or fail, right? For you to make that determination. Okay, quality department, let's kind of jump on with them and their added responsibility for this. Now, the quality personnel basically is going to be recording the shelf life determination and make sure it meets the food safety requirements that's been declared by either the company or the formulator or the customer at this point. The qualitative criteria has to be described and has to meet the customer specification at this point, okay? On the quantitative criteria, sometimes we tend to forget the headspace as well. So as a PCQI, you want to take a look at that if you're dealing with powdered products or any products that has that space. We call the headspace. If you need more information on that, let me know. That just kind of popped in my head. So I'm sorry, I got a lot of things going on here. Equipment and utensils qualification also come into play at this at this stage for the quality department or quality personnel. Their sanitation and allergen controls are also determined at this stage by the quality people, and approved supplier and vendor requirement. So as a PCQI, you want to keep an eye out on that because of all this new process of how you approve your suppliers. Or through your supplier approval program, how all of that correlates to your process, okay? And we can go over it. We're gonna have a video of all of these things that I'm a little vague on because it just spins off to that other subject and trying to prevent of having a 2 to 3 hour seminar in every program. So bear with me, okay? I do apologize for that. And then finally, the purchasing department, okay? So which is the buyer, right? Which is for the facility. So this particular buyer sources all necessary materials. So all of the ingredients, raw materials, packaging and processing aids requirement will come from the team or from the formulator, obviously, to be purchased by the company's buyer. Okay. Now, some of your clients, they buy their own materials and ships it to you. So obviously, you're going to need more information of how do you accept those type of materials. Through the paperwork necessary for them to disclose to you, such as COAs or spec sheets, okay? Quality and the safety requirements on this stage for your own process, as well as meeting the customer requirements, falls into the purchasing department / buyer. So they're going to need to be part of the team after the scaling up happens, because you might have some deviation on raw materials, ingredients, or certain packaging materials did not pass the qualification stage and has to be adjusted. Or perhaps needs to find an alternate or a substitute vendor for that. So, okay, part of this program, we've also have the validation and verification of the food safety plan, where the practitioner in this particular program is under SQF. So we put the requirements of an SQF practitioner to be able to validate the food safety plan, right? Part of that is reviews and also approvals. So this is where we put the authorized persons or designated personnel, such as the plant manager, the sales manager, the quality manager, or some of the C-level senior management as well. Now, this program, we added a frequency for reviews. So if there are no changes, at least an annual review is required, just to make sure if there are any changes on any product formulation or their deviation, and they have to be reconsidered for this exercise again, or this particular program, and they have to go through those same verification and validation again. All right. Part of this section is record keeping and monitoring. So these are very, very important, obviously. Now, for records, it fell into the quality department to keep all records of this particular activity. Production is going to want to take copies of this information as well, because it affects them for the scale-up process. So as a PCQI, if that happens, make sure their procedures and the quality department, they're the same. So there's no conflict during verification activities that, oh, we were supposed to be doing it this way. Nope, we're doing it now this way. So now you have a little bit of conflict. What is being verified, when, and who's doing it, and frequency, and all of that. So it's a domino effect of failure at that point. Okay. So as a PCQI, please be mindful. Any information coming out of one section must meet the equality of that particular procedure on the other department. In this program, we also put records retainability, record keeping of how many years do you need to keep it, because one space. If it's digitized in whatever your policy says for records, please follow those, all right, on your company's documentation program. Then we put a section for responsibilities. What is sales and marketing's responsibility, for maintaining the product realization process of this? Why is sales and marketing involved? They're the one that brings in the customer. So if it's a customer requirement, they have, they got to make sure as they're building that relationship or they're keeping that relationship, the sales and marketing team is qualified or should be trained to ask certain questions. If there's formula changes or if they're discussing new ideas, that department is also communicating with our PCQI, our production team, and all of that. So there's that open line of communication for potential changes. Purchasing department, we already talked all about that they are in charge of all the sourcing of the materials and the support of production. And then we lined up what production's responsibility is, again with the quality department, sanitation, and the practitioner. So we had added other responsibility outside those processes that are performed on behind the scenes. And we added a section, though, what I call what if it didn't work, or in the event of this didn't work, we put those under corrective actions. So this is the part where, you know, what happens, or in the case of such and such not working, what is our corrective action. In this particular stage, it's just common sense. It's just a basic process. If the organoleptic specification of the customer is not met during the scale up, obviously you're going to be doing reformulation, you're going to be processing it. So you want to document all of these things, especially, let's say, just for the sake of example, you're baking a cake and it comes out of the oven and it didn't rise up, or things like that. You know, what are you going to do? You're going to re-review the recipe, look at your cooking instruction or baking instruction and whatnot. So make sure those are all recorded. And then at this point, and just a little bit of a tidbit again, once these are approved, make sure they're signed by the formulator or the authorized person, because sometimes there's so many changes on recipes or formulation processes. You know, you could have one version in the morning. By the time you're done with the trial and you're scaling up, you would have 27 versions. I have seen it as high as 108 in doing a trial in a 1 week period with a customer. Okay, so make sure those are documented and logged in. So at the end, once you finally figure things out with the equipment, with the personnel, with the time, and all of those processes, you nailed it. Instead of, oh, which version? Version 7 worked. Well, we're on version 29 now. You know, how did that work out, right? So, you know, just pay attention to that. Okay, and we added a section here for the quality review or review by the quality department. So this particular program, once you set it in place, you just don't leave it there. So it has its own requirements, at least once a year, to be looked at and assessed for changes, or if there's any regulatory or customer requirements, updates that needs to be added into your program. Obviously, when there's changes occur as well. And then we added a section for reference documents. So because this is a program, so the way we do things is we identify what program you're complying under. In this event, it's 21 CFR Part 117, which is our CGMC HARP-C for human food. So that verbiage is on there, as well as our SQF requirements that this particular program falls under. So once you have those, obviously you have your policies and procedures. This section of the reference document is basically the forms. Okay, so during an audit, when I'm doing a deep dive audit, I look for that. I'm like, this is a wonderful program. Oh, I see your policies and how you do things, through your procedures and SOPs at this section. Along with this program, we're also incorporating a section for reference documents. The reference documents, basically, these are the forms that are related to this particular programs or this policy or these procedures. So we put in our product development, validation, and verification forms, product formulation and realization forms. The food safety plan is also included as part of this program. The supplier approval program is also there. Applicable certificate of analysis, letter of guarantee, letter of conformance, specification, and the shelf life programs. So those documents pertaining to all of those programs are basically also attached to this particular program. One section also for references. So all of the references or guides that we use in compiling this program are also referred here. So during an audit, we may reference those just in case the auditor or the investigator had asked, where did you get that information from? So it's actually is part of that program as well. And lastly, we have the history section where we record all those revisions and recording of all the applicable changes. All right. Okay, PCQI, now that we've completed the program for our finished product specification and realization, we are now going to work on the forms that needs to be created for this particular register to basically correlate to the finished product and formulation program. So it's a simple form that you're going to have to create where you have your product codes, your finished product codes, product name, the description of that product, pack and type for that, and then the shelf life, if you're doing it in days, in months, or in years. A lot of it probably just going to be in months, right? And then you're going to identify it if it's an actual shelf life study that you're doing. And if you need more information on that, just let me know as well. Or if it's an accelerated program. And the most important part of it is what is the status of that finished product that you're monitoring. Is it still active or not in use, and things like that. And before I forget, make sure on your product code, if it's the same as your formula code, then you're okay. But if not, please identify the formula or slash recipe code for that. So when you are tracing formula slash recipe to the finished product, remember we were talking about the versions. Sometimes when you're scaling up, it's really different when you're doing it on paper or in your own test kitchen, all the way to your full PQ, where your production qualification is. So those things are going to change. So make sure they're annotated on this form. So when the auditor asks for it, you can trace all of your activity on your product realization program to the commercial stage. Okay? Thanks again, PCQI, and have a good day. Bye-bye. Contact us. And don't forget to share, like, and subscribe. Thanks again, PCQIs. Have a good one.